Hello. Do you shy away from the cameras or you just hide your smile when smiling? Why is this so? Why are you not finding your smile to be a perfect smile? Have you noticed anything? The reason for hiding your smile can be the black triangles. Yes, the picture which I am showing here is clearly showing some dark areas. These dark areas are called as black triangles. The black triangles are also called as open gingival embrasures. This black triangles is the area where your gums, the gum tissue has gone down from its original position. And why is this happening? Come, let us have a look at this today's video where we will be discussing the reason for this black triangles and how can we treat it. Come, let us have a look at this video. Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, today we are discussing the gingival embrasures which have opened up, or what is known as the black triangles in your teeth. We all have been always wanting some Bollywood movie star kind of smile. We all love to have that white, bright, perfect smile because their smile is the best thing to impress somebody, to talk to somebody, and this helps you to easily socialize. These triangles completely change the way your smile looks. And do you know that roughly 70% of people about 20 to 25 years of age will have these black triangles in their mouth? These black triangles not only change the way you look, but it is not only a matter of aesthetics, but they also change the way you eat. It causes a lot of irritation when the food gets stuck in between these black triangles. So what can we do? Keep watching the video as I am going to tell you the treatment options. Before that, let us discuss the cause. So let us move to what are the causes of this black triangles. The first and the most common cause is gum recession. So what are gums? Gums are the pinkish part which is there to protect your bone and the teeth, which is there just covering the roots and just present above your crown portion. So these gums, when they leave their original position, they start receding. Receding is going down, going below. That is the time when this spaces gets created. Now, what can be the cause of this? Yes, the most important and the most commonly found cause for this gum recession is gingivitis and periodontitis. That is infection, inflammation of these gums, which is caused by buildup of plaque, dirt, yellowish buildups in your mouth. And this plaque is also, if not cleaned in time, is responsible for cavities in your mouth. So getting your plaque cleaned is going to help you out here. So this plaque irritates the gums, and the gums in response to that infection and inflammation goes down. So when the gums go down, that is what we call it as recession. Now the second thing can be if you have some habits like smoking, hookah, tobacco chewing. All these things do cause irritation to the gums, and the gums color and texture starts changing. With this, the gums also start receding. Do you know that diabetic people are more prone to have gum infections? Also, in pregnancies, due to hormonal changes, this kind of gum infections are seen. So, if that is the reason, then if you're diabetic or pregnant, development of these triangles over a period of time can be found out. So, you should take special care. Then next reason can be aging. Yes, aging leads to recession in the gums because the bone underlying is going down. That is the third cause too, the bone loss. Osteoporosis of the whole body. It also affect the bone in the mouth. So that is the time when the gums start, the bone starts losing. Or the bone loss again in the repetition cycle can be because of the infection, the plaque, gum diseases again, and this gum diseases infecting and affecting your bone leading to bone loss. So as you can see, it is a cycle. Gum diseases, gum recede. If there is a gum disease, gums will recede. The gum disease will cause bone loss. Bone loss will again cause recession or decrease in the level of height of your gingiva or gums. So it is a cycle which goes on repeating. The next reason can be braces, that if you have had recent treatments, the tooth is taking time to shift from one place to another, and same, the gingiva is also taking time to adapt. Sometimes the gingiva is completely fully grown, sometimes it does not. And that is the time when it develops this black triangles. The tooth shape is the next cause. Yes, it is physiological, where the shape of the tooth is quite, especially the anterior ones, they are broader at the base and that gets narrower towards the root. So if the narrowing thing is more, then the two teeth, when placed besides each other, will show you this kind of black areas. So friends, whatever may be the reason, you can definitely treat this. So how? Come, let us find out what are the treatment options. So the first treatment option for this is definitely what? Yes, you guessed it right. Treating the gum diseases. How? The gum disease can be treated by removing the cause of the gum disease, that is the plaque. So this plaque can be removed by scaling and polishing, that is professionally cleaning your teeth. Once the dirt is removed, the infection, the inflammation is removed, then slowly, by maintaining good oral hygiene, you can definitely have these gums treated, and once the infection is gone, they can develop and come down to their original state, and this black triangles will get closed. The next thing is, I mentioned to forgot in the cause that brushing too hard also irritates your gums. So that is one cause of receding gums. So what you have to do is maintain good oral hygiene, use medium soft bristles toothbrush, do your flossing in the right direction where you don't irritate the gums. If you are not aware of how to floss, do make sure you watch this video on how to brush and how to floss, because that is going to help you to actually understand the technique properly and not do more harm to your gums. Then treatment of bone loss can be done. In the severe conditions, if there is bone loss, then grafts can be placed and the level of the gums can be brought down to their original position. If the gums have receded to quite a lot of degree and there is a lot of cleaning that is required, then a surgical procedure can also be done, that is called as flap surgeries, where the gums are opened up, they are treated and they are stitched to their original position. For this you require a specialist, that is who is a periodontist. These are the dentists who have specialized and taken a master degree in gums. So they are going to help you out to maintain your gums level. Now the next thing is that if you do not treat the gums, or after treating the gums also these spaces do persist, then what can be done? The way to do this is hiding the spaces by increasing the size and the shape of your crown. So that is a secondary treatment, I would say. The primary treatment is always going to be treating the main cause, removing the bacteria and the infection. So this can be done by crowns and veneers, where your tooth needs to be trimmed a little, and then a larger size tooth or crown or veneer has to be placed there, where it helps in hiding these black triangles. And yes, aesthetically also the shape and size and the color of the tooth changes a lot by placement of this veneers and crowns. So if you are very much conscious about your smile, this is a right option, I feel, for you all. Then if there are some minor changes which has caused because of braces, composite resins, that is just a filling or a build up, can help you out in certain cases. So your dentist will be the right person to guide you out on what treatment and how can this treatment go ahead. Friends, do make sure that you keep your teeth and gums in a very good and healthy state, because this black triangles can definitely be avoided by just practicing 3 things in your life. 2 times brushing, flossing every day, at least once in a day, and using appropriately mouthwashes. When I would recommend, if your oral hygiene is good, twice in a week, otherwise as and when recommended by your dentist. Also, increasing a lot of vitamin A and C in your diet helps you to have and maintain good skin health. So that is equal to good gum health. The other things which are like new into technology is just like as you increase your skin volume and do tissue regeneration there, gums volume by using hyaluronic acid or gums tissue can also be increased by such methods. So if the triangle is small and your dentist feels that it can be done by this fillers, then yes, this can definitely work for you as well. So these were the treatment options, and I hope this video has helped you to know what can be your cause and how can you get it treated, and how can this black triangles be hide off and you can have your original smile back. Friends, hi, I am Dr. Mansi Shah, practicing in the city of Pune. This is my email address. If you have any queries, make sure you ping me here, and I and my team will be very much happy to revert back to you. If you have any other questions, doubts, you can always mention it in the comment section here below, and I will be glad to answer them. Or if possible, make a video on them, because others will also be benefited from it. Do make sure you visit my channel Dr. Mansi Shah. Watch all the oral videos which are quite interesting and definitely helpful in your daily routine. So make sure you do visit them, like my videos, share it with your friends, and do not forget to subscribe to the channel and press the bell icon so whenever I post a video on Mondays and on Thursdays, you get notified. Friends, wishing you all a very happy, healthy and a bright smile. Stay healthy, stay happy, stay over fit. Thank you.